Yes, I worked as an anesthesiologist all the way up until went through all of my schooling till 2021. So 20 years. And I walked away in 2021 because of I will say, ethics, morality, and wanting to make sure that had control over my own health and that of my family's. And I didn't think I'd be gone for very long. And I don't sit idle too well. A lot of things that I was being told to do in the hospital setting was the opposite of what I had been doing for the previous 30 years. And so I was doing a lot of digging and uncovering information that not been taught in my conventional medical education. And one of those things I came across was that light is the driver of all of our physiology. So modern medicine focuses on the biochemistry of the body. And it's not to say that that's wrong, but it's very incomplete. And that means that how we can actually use therapies is very incomplete and limited. And so when I came across this idea, I started doing so much digging and research. I know Dr. Jane's been looking at phototherapy or using it for 30 years. But this was my introduction to it. And I just became fascinated with it and dove very deep for a few years. And then I came across these patches in 2024. And so for me, it was not a hard leap to understand that this could actually work because of what I'd just been studying for the previous 3 years. And these patches, again, like I said earlier, they specifically increase a peptide, the X39, the GHKCU peptide. And so that's not something that a red light panel does. So it is a very different effect. It also increases mitochondrial efficiency as well, but a red light panel does not increase those peptides specifically. But we were not taught in medicine that the body heals itself. We were not taught that. When I look at my career, and I understand now how modern medicine works, and I'm going to exclude emergency medicine. That's completely different. But when we're looking at how chronic disease is managed, that's exactly what it is. It's managed. It's either we try to stabilize things as much as possible or prevent the decline or help people alleviate some symptoms, but we're never actually healing people. And we're not healing people anyways to begin with because the body heals itself, but we're not allowing people or giving them the support that they need to heal. And with these patches, what I've seen in 2 years, because it's been just over 2 years for myself, I have seen people's symptoms, and this is just my experience. This is not any medical claim, but I've seen people's symptoms be alleviated. They don't have them anymore, and they're not having to use the same medications or supplements that they used to have to use. They're more comfortable, and their quality of life just has improved so significantly to the point where I have not seen this happen in the 30 years that I've been in medicine. And to the point where I know in the back of my mind, and this was a subconscious thing, I wasn't quite aware of this until later on, but because of everything that I saw, and I saw the complications, which is just the nature of intervention, right? And I was in an acute setting in a hospital, in the operating room, in the ICUs. So I saw the complications. But in the back of my mind, I knew I had to make sure I was as healthy as I possibly could be because I did not want to end up in a situation that I saw on a regular basis daily and worked within. Her career was giving drugs. Like my entire career was injecting drugs into people and trying to balance things from an outside perspective. And yes, for surgery and keeping people alive. And that was at the time what I had to do. But it caused a lot of effects in people that I saw, but I also didn't see. And short term, but also long term, that's maybe just not followed up or the research is not necessarily done there. So to me, it is way better to use our own natural resources than to take something in from the outside because we just don't know. There's a wisdom to the body that we will never understand.